You talked a little bit about the Affordable Care Act, and then your department's involvement is mostly through the insurance aspect of it, correct?
That's correct.
Have you seen, can you talk a little bit about cancellations of individual policies that we've seen in Tennessee as a result of the Affordable Care Act? Has that been an issue? I know it's been, it's been talked about as being a big issue going forward. Kind of what's happened with respect to that?
Well, that's exactly right. The Affordable Care Act required all health insurance policies to cover what are defined as essential health benefits. So insurers couldn't have just any product in the marketplace beyond the implementation of the Affordable Care Act. And those policies had to be ACA compliant. And if a policy did not comply with those essential health benefits, it was required to be canceled, particularly after the time for the transitional policies was allowed. I mean, if you remember, the president said if you like your policy, you can keep it. And then to implement that statement, he allowed those transitional policies for a while. But eventually, all of those policies need to move to ACA compliant policies under the law. And that's where you're seeing a large number of cancellations, because insurers are no longer allowed to offer those blocks of business for policies that no longer comply.
And you were saying that one company has sort of dominated even more so. I assume that would be Blue Cross Blue Shield of Tennessee.
That's correct.
In terms, and so they've got, how much of the business did they have initially, and now they got 90%?
We had calculations in our office that it was about 78% of the individual market prior to the exchange, and on the exchange they are roughly about 92%, I believe, of the policies that were purchased on the exchange.
I believe I saw maybe a press release or something maybe a couple months ago where you had approved some premium increases for Blue Cross. Was that related to ACA as well?
That's exactly right. Yes, the first year out, Blue Cross and all of the insurers that were participating in the exchange didn't exactly know which Tennesseans were going to avail themselves of the policies and what their risk profile was going to look like. And it did turn out that Blue Cross did need a substantial rate increase for 2015 to participate in the exchange. And like I said, we did hand that to our actuaries to review, and those rates were actuarially justified.
But so in other words, also these people that have had their policies canceled, when they renew, they are paying 20% higher premiums than what they were paying before.
That's exactly right.